Hey everyone, welcome back to my channel. If you're new here, my name is Penny. I am a master esthetician in Portland, Oregon, and I'm excited that you're here with me today, you guys, because we're doing the Friday Q&A, only we're doing it on Wednesday. And thank you so much for your patience, everyone. I was sick last week. Luckily, I had a couple videos in the queue ready to go, but yeah, some crud took my entire family down. My kids were sick and then I was sick and there was no filming. That was not happening. So we are doing the Friday Q&A on a Wednesday, and it may become the Wednesday Q&A. I'm not sure, but I'm excited to do this now because I put a lip line video up that I will link. And I got so many questions that I'm excited to be able to address this way. So this kind of worked out anyway. So let's get right into it. First question is actually about LED. And this comes from Yi Qian. And she says, I am doing microneedling once a month at home and wanted to add an LED mask too. Is it safe to use both? If so, how often should I use an LED mask along with microneedling? This is such a great question, and I just want to put a blanket statement that LED, especially near infrared and red, LED and microneedling are best friends. They are great together. So just in a nutshell, remember that with microneedling, what we're doing is we are inflicting a controlled injury on our skin, which causes this kind of cascading series of events to happen. And that is the wound healing process. And in that process, their inflammation is kicked off. That's just part of it. That's what has to happen. The good side of what happens is obviously collagen production and, the good things that are anti-aging. But that inflammation, it needs to be balanced. That's why I recommend that you use a high molecular weight hyaluronic acid, because it's anti-inflammatory when you do microneedle. Now, LED, especially near infrared red, is anti-inflammatory. So it is one of these modalities that is absolutely perfect to use post microneedling for a couple reasons. First of all, it helps to stimulate something called ATP, which is adenosine triphosphate. That is a life source for our cells. I'll link a microcurrent video where I talk a little bit more about ATP, because we stimulate ATP through microcurrent as well, and it's a good thing. So LED does that. It stimulates collagen in a different way than microneedling, but it's also anti-inflammatory. So the two modalities are fantastic together. They're fantastic together at the time that you microneedle. So when you do your once a month microneedling, to follow it straight up with an LED session, even if it's just 10 minutes, is great. That is the perfect time to do that. The only caveat is if you're using any kind of an LED that might touch your skin, just remember that you have these open channels for an amount of time, and you need for anything that might touch your skin to be super sanitary. So if it doesn't even touch your skin at all, no worries, you're good to go. I would still keep it sanitized, obviously, but just be careful. Some of these masks and things are, they can touch your skin a little bit. They have to be swabbed down and cleaned, at least wiped down with alcohol before you get them anywhere near your face after you've done microneedling. Absolutely safe to use with microneedling, and actually recommended not by just me, but in protocols like in the Dermal Needling book by Dr. Lance Setterfield. So I didn't just come up with this. He calls for LED in his medical microneedling protocol. So it is definitely safe and great to use together. Okay, next question. This one comes from Sarah Stroud, and she says, hey Penny, I was wondering if I can use the Dr. Penn A6 without numbing cream. Will it be too painful? So that's kind of a yes and no, because I would say that anytime you go to medical needling, when you go to 0.5 and deeper, I would suggest numbing. And the reason why I suggest numbing is at 0.5, it's still relatively tolerable. You really could get through it. The forehead and above the lip, pretty spicy, but you could get through it. The problem is there are parts of your face where I really do feel like you should turn up the dial just a little bit, even if it's just to 0.75. And the likelihood is you're not going to treat properly. You're not going to do the depths that you need to do if you're not numb. because it is uncomfortable. So when you're planning to do your once a month medical needling, yeah, I would definitely numb, because then you're ensuring that you're gonna do the proper treatment depths all over your face, and it's not gonna be in consideration of your pain tolerance. It's going to be just because you need to needle at certain depths in certain places. I hope that that makes sense. Now, when it comes to cosmetic needling, I absolutely do not think you need to numb. It is completely tolerable. I think it would be a waste of time, a waste of numbing cream, and I think of too much exposure to the numbing cream if you're cosmetically needling often. So that is 0.3 millimeters or more shallow. So 0.3, 0.25, 0.2, definitely don't need. The other day when I did that lip line video, you guys, I had it set probably at 0.2. You guys, it was hardly even annoying, let alone painful. So, and the upper lip is one of the spiciest places on your face. So you definitely do not need to numb with the cosmetic needling at all. So hopefully that answers your question. This question comes from Kelly Cooper, and then Jody Fro Gunderson also added into this one. And this says, would you add anything to this process to correct droopy, turned down corners of the lips? Thanks. And then Jody said, Kelly Cooper, yeah, no doubt. I'm so tired of looking sad/mad because of the downturned mouth. I'm looking for facial exercises that will help this too. And then she puts a little frowny emoji, you guys, and it says me when I'm happy. That cracked me up, you guys. That was pretty funny. Here's the thing, reasonable expectations, and I hate to be Debbie Downer here, but microneedling is not going to change your downturned mouth. It isn't at all. So what's important to know is, okay, so what do we do to help with that? Because that is something that bothers me so much as I'm getting older, you guys. And I will tell you that there are things that you can do. And there are things like Botox. All of them are going to be in office. You could probably do a little bit of microcurrent, and you might be able to help get a little lift. But you'd have to do a lot of microcurrent, and you'd have to be very, very consistent. And even then, I'm going to say that you're going to get super subtle, if any, results. So the things that you can do, not talking about surgery or anything like that, you can go talk to a provider, and they can do filler around the corners of your mouth, and they can also do some Botox that might be able to kind of give the illusion of, you know, turning up the corners of your mouth. This one comes from Michelle Crossland, and she said, I did one treatment at 1/1.5 millimeters microneedling last Sunday, and it sounds like she did them on her lip lines before my video came out. She said, mine look worse. Is this normal until the collagen rebuilds? Okay, such a good question, and I did answer her in the comment section, but I thought I would put this out there to you guys because this is an important expectation again. Now, when we microneedle, there's definitely a phase after you microneedle where you may feel like for a few days or a week that you actually look a little bit worse. And what is happening, you guys, is first of all, we may be experiencing something called transepidermal water loss. So we've actually lost some water out of our tissue, which makes us look a little bit worse. It makes you look dehydrated. Your skin might just not look as supple and bouncy, that kind of thing. And on top of that, the outer part of your skin has to resurface because it had a bunch of holes poked into it. So you might get a little bit of dryness and tightness there on the very surface, and you might get a little bit of flaking. So all the way around for a good, week, you might be like, ugh, I look worse. What's going on inside with the collagen rebuilding and all of that kind of stuff, that's long term. So it's understandable for people to be like, I feel like I look worse. But here's what I do know. When that all subsides and your body regenerates its hydration and its water is recaptured, then you look so much better. There is about a 10-day glow that happens post microneedling. Comment down below if any of you microneedle and you notice this yourselves. There is this good 5 days of kind of like flaking, dryness, tightness, that kind of stuff. And then at about day 10, I always feel like, wow, my skin looks really great. And part of that is because all of that resurfacing and all of that retexturizing has happened. And I am getting to kind of, live in the glow of microneedling. Now, the other thing, you guys, that you can do is you can use that kiwi seed oil. That is going to help to replenish the tissue. But you can also use things with glycerin or hyaluronic acid or urea, sodium PCA, things that are humectants, and you can seal them in with a nice occlusive moisturizer to help aid in replenishing the tissue. So, and I'm talking about something like CeraVe. You don't need to spend an arm and a leg on an occlusive moisturizer. So if you experience that, especially around the lips, you guys, we're using retinaldehyde, which is definitely more gentle, but you can experience some dryness there. If you notice that at night on damp skin, use something with a humectant like I just listed, and then go over it with an occlusive moisturizer like CeraVe, and you will help speed along the recovery of that skin on your lips and around your lips to look more plump and juicy and keep the tissue hydrated. So hopefully that helps. Totally normal. And yeah, you definitely at 1 to 1.5, you stimulated some collagen. So that is on its way down the road. Let's see, this one comes from Barbara Steffenhagen, and she says, can this protocol be done over fillers? Such a good question, you guys. My lines were severe, and even with Juvederm filler, I still had a few that are surely visible from outer space. If yes, how long should I wait until after getting filler to needle? Also, will this routine work on forehead furrows and rabbit lines across the bridge of the nose? Okay, first of all, my rule of thumb at work is 2 weeks. I say 2 weeks post Botox, 2 weeks post filler. It's just a good rule of thumb, but you definitely can microneedle over filler. You're fine doing that. Now, as far as the bunnies and the 11s, yeah, you can definitely do the same protocol that we did around the lip. Just remember, there are other things at play here. These are dynamic, lines because of muscle. So same here with the bunnies. So what's happening when we're doing this microneedling and retinaldehyde and vitamin C is we're trying to thicken the dermis and really improve the skin quality. But we're not changing the fact that we have muscles that are moving all the time. So a lot of times the best way to approach, especially here and here, that is more difficult for our lips is a combination of Botox and microneedling with what I'm doing around the lips. Great combo, you guys. Obviously, we're separating them out. When you do your Botox, you have to wait a couple of weeks before you needle, or you needle before Botox, obviously. But the idea is you atrophy those muscles so that you can't repeatedly make the lines. And then with the microneedling, you are helping to thicken the dermis, stimulate collagen, all of that stuff, so the skin quality is better, and it's kind of a 1-2 punch against those 11s and the bunnies. Okay, this next one is from Laura, and she says, do you think this will also help plump up our lips if we go a bit on them with our pens, staying at 0.25 or below, that is? No, and here's the deal. You might get temporary plumping of your lips because of edema, swelling, that kind of stuff, but I wouldn't needle your lips on purpose. What you can do though is nano. You can nano your lips with hyaluronic acid. It will plump them by virtue of hydration. So I definitely love nano needling over the lips because there are actually no real needles, and it does give the lips a nice plump. So as far as the lip lines with the 0.3, 0.25, 0.2 needles, that's all outside of the lips, guys. It may touch obviously into your lip just a little bit inadvertently, and it's going to plump that just a little bit. It's going to pop it up. That's just swelling. That's edema. That's not collagen. That's not genuine, plumped up lips as in long term. In fact, if you repeatedly did that, you're repeatedly causing inflammation to the area. And remember, inflammation is pro-aging. So if you are needling over your actual lips and you're getting this constant nice little plumpness, just know long term that's going to age your lips. So I definitely would not purposefully needle your lips. This one is from Zotzi. Now, I got this question from a few different people, so I'm excited to answer this, and it is about the JJ Labs tranexamic acid that I talked about several videos ago, comparing it to the Deer Skin Tranex. Now, I want you guys to know they are both awesome serums. I've just gone through my entire JJ Labs serum, and they're actually quite similar. And the JJ Labs uses hyaluronic acid first, then tranexamic acid. It also uses arbutin. Now, there isn't arbutin in the deer skin, and we know that arbutin is a great non-hydroquinone pigment inhibitor, so that's a fantastic ingredient. Then also in the JJ Labs, you guys, is licorice, vitamin C, vitamin E, and those all are also in the deer skin. If I had to choose, you guys, I actually think I like the Tranex better. I like the fact that the deer skin product tells me that it's 5% tranexamic acid. I just appreciate knowing that number. So I feel like the Tranex is just a little bit more active, has a little bit, you know, a few more things in that cocktail that I really, really like. But that JJ Labs is a fantastic product, and if you like it, I say continue to use it. I mean, it is a great product, and had I not found this Tranex, I would be rebuying that JJ Labs. So both are absolutely great for hyperpigmentation, pigment issues, all of that kind of stuff. So hopefully that helps those of you, because I know that the two products are quite similar or sound similar to you, and they actually are quite similar, and they're both great. So hopefully this answered enough of your questions, you guys. Thanks again for bearing with me. I'm still not 100% well, in case you can't tell. I am getting ready to travel, you guys. I am going to a train the trainer, an education training back east for hair. And a lot of you are new here, but I was a hairstylist for many, many, many years, and I still teach hair extensions. And I'm super excited because I'm going to a 3-day training back east to learn a new method so that I can bring it back to stylists in the Pacific Northwest. And I teach hair extensions in salons and in showrooms and that kind of stuff. So I'll do a little bit of vlogging from there. I'm very, very excited. I'm super excited to get my hands in some hair. I miss it, and I'm excited for it. So I will definitely do a little bit of vlogging and checking in with you guys from back east. I hope you guys have a fantastic day. I am planning to do a little travel packing video too. I think I'm gonna show you the skincare and makeup that I'm taking, because I think that's kind of a fun way to see what your true favorites are, is the stuff that you would take on a trip with you. So anyway, I hope you guys have a fantastic week, and I will talk to you again very, very soon. Take care.